My name is Brian Romacco, and today we're going to be using a Suresult D3Ultra Handheld Ultrasound unit to evaluate a thumb for a gamekeeper's thumb or skier's thumb. It's basically a tear or injury to the ulnar collateral ligament of the thumb at the first metacarpophalangeal joint, the first MCP joint. So it's right here. And this injury can be quite common. Basically, you have any force that sort of does this, so skiing, mountain biking, any sort of wrenching or quick force on the thumb in this direction can cause a tear of this ligament. Since the ligament is very shallow, the higher frequency you have access to, the better. On the Suresult, this is a general purpose probe, goes up to 10 megahertz, which is enough to make this diagnosis, but if you have access to something even higher frequency, that would be useful. But don't worry if you have a general purpose probe, because a significant injury you will notice. And frankly, you can't miss it. There's nothing like it. In terms of patient positioning, we'll actually have a table, and the patient will, with a rolled up towel, just have their hand on the towel, just relax, and that gives you perfect access to the ligament. Now, in the case of a normal and healthy ligament, we should be able to see the fibers of the ligament, and we should be able to see the adductor pulsus aponeurosis on top of the ligament. And if the ligament is injured, we may see discontinuity of those fibers. If we do a little valgus test, we may see fluid entering into the cleft of the tear. The ligament itself may be thickened and darkened, more hypoechoic. And if there's a full tear, a full rupture, you can get something called a Stener lesion, where the ligament sort of bends back around the aponeurosis. And there's nothing like it. There's nothing like a Stener lesion, and they call it the yo-yo on a string appearance, because you have the aponeurosis, and you have this sort of bundle. It can be a more oval bundle, sometimes a tall circular bundle, and because the fibers are curved, you end up with a lot of artifacts in terms of anisotropy, and it looks like a dark circle. So you basically have the aponeurosis going to this dark circle, and there shouldn't be a dark circle there. You can always turn on split screen and check the asymptomatic side if you forget what normal looks like. But there's nothing like that. The string on a yo-yo appearance. That's a Stener lesion. That is a full rupture. And of course, you won't see the fibers of the ligament where they should be, underneath the aponeurosis, because they're sort of bent and rolled up at the end.
Okay, so I have my sample patient here, and her hand is nice and relaxed on the towel. This is sort of the standard setup. Of course, you don't really need the towel if you don't have one. You can still make it work, and I have my transducer here. We'll place it right at that ligament, and everything looks normal echogenicity. With a higher frequency ultrasound transducer, you'll see the fibers a little bit more clearly, but this is enough to tell that things look fairly normal. And I can ask the patient to wiggle the end of their thumb, and we should see the aponeurosis sort of wiggle back and forth on top of the ligament. When in doubt, use split screen and compare with the asymptomatic side. And remember, what we're really looking for is that Stener lesion, which would indicate a surgical referral. And remember that a Stener lesion is an obvious round, circular, dark circle called a yo-yo on a string appearance, and you really can't miss it. It's quite obvious. And that's really all it takes to check for a Stener lesion. It's nice, quick, and easy.
And I'll just add that Suresult, if you're interested in some of their ultrasound units, they've told me that a lot of people are concerned about shipping and duty and whether it meets international standards. And they've told me they've put a lot of effort into addressing duty concerns and addressing shipping and addressing these international certifications. And if you have any doubts, you can always contact them. They are very responsive on WhatsApp. Cheers.